do intro shortly, but Sarah approached us from the CIH and said, we saw the amazing work you're doing before. Can we relaunch this? Can we rerun it and give this a bit of a boost again, really? So it's lovely to see so many people in the room already. I know we've got a number of people who are going to be joining shortly as well. To those who don't know me, so my name's Matt Baird. I've been, I guess, involved in one way or another with social housing for about 12 years now. I am a recruiter by trade, so I've recruited in housing for most of that career. Something I, like many people, kind of fell into and then have just loved and adored, really. And I set up on my own 3 years ago. I'm the founder of the Social Housing Roundtable, which I think a number of you know me from, which is great to see. That is a free weekly networking group where we discuss anything and everything in the broader social housing space. And I'm co-chair of the board for Spring Housing, which are a charity in Birmingham that focus on young people, homeless and refugees across kind of Birmingham and Warwickshire, providing support in many different guises for them. So kind of wearing many hats. I'm going to introduce Eden and Sarah. Eden is my I guess, the co-founder of the original version of this, and then Sarah is our wonderful advocate from the Chartered Institute of Housing, who has come along to help us kind of relaunch this. So Eden, I'll pass over to you to introduce, and then we'll pass over to Sarah, who is going to discuss some of the regulatory changes from the supported housing space before Eden focuses a bit more on the non-regulatory providers aspects, and we're looking at charities and CICs, etc. This will all be followed up, by the way, with a Q&A or ideas from you, really. This isn't a CIH group, this isn't a me and Eden group, this is a collective group, and as I said, there is a WhatsApp group which we can invite people to as well, where the idea will be that we talk about what everyone here would like to hear. We're looking at doing sessions every kind of 8 weeks or so, so let us know what you want to talk about through the year. But Eden, I'll pass over to you to do introductions.
Thank you very much, Matt. So welcome, everybody. Lots of familiar faces here, but some of you might have known me already. But just to introduce myself, I'm Eden Bailey. I'm currently working for a charity called HFT. So HFT is a provider of supported living for people with learning disabilities. I'm the head of housing services there, and I've been with them for about 2 years now. I have co-founded the Supported Housing Networking Group with Matt. Some of you must have attended some of our session in the Supported Housing Networking Group in the past. Obviously, it's been proven quite valuable to those people that working in the supported housing space. So we thought to sort of revamp, relaunch it. But now this is in partnership with the Chartered Institute of Housing. I'm also the chair of the Chartered Institute of Housing in the West Midlands. So I'm heavily involved with CIH on my day job, my day-to-day role. So kind of knowing anything about registered provider of social housing and any new legislations and things coming around within the policy framework, if you like. I'm also a board member for a small housing association, the Birmingham Civic Housing Association in Birmingham. So I've been a board member there for a good 3 years now. So just keep up to date in terms of, strategy, risk management and things like that. So yeah, welcome everyone. Like what Matt said, we also have a WhatsApp group, which is now live. We got probably about 30 to 35 people on our WhatsApp group. It's just basically sharing best practice. If you got questions around supported housing or just, wanted to ping some ideas, you're more than welcome to message me privately, and then I could add you on the WhatsApp group as well. And that's for me, and I'll pass over to Sarah.
Thanks, and welcome everyone. And I'm Sarah Davis. I work in the Policy and External Affairs section of the Chartered Institute of Housing, and I've worked for them for a long time. Shan't go into the number of years, and I've been in housing for quite a long time. Prior to CIH, I've worked for local authority and allocations and for a few housing associations. And my kind of favourite roles in that were always around issues with older people. So I worked for a specialist as well at one point in housing for older people. In CIH, I have I kind of like lead on where the overlap is between housing, health and care. And so you know, I've been following the supported housing network that Matt and Eden set up. Really enjoyed being in part of the audience, and so recognizing that we're all really, really busy, was very keen to help keep this going. CIH does have a number of community of practice groups, usually solely for members, but because this one was already so flourishing, we wanted just to support it carrying on. So I'm here a bit to participate and to listen and to learn and to understand what's going on. Also to bring any kind of help and knowledge that I can. Obviously, I come from the regulated provider sector predominantly, and it's always great to know the broader experience of policy on the ground and what it means, because from a policy a policy person's kind of perspective, you can have great ideas of how things will work, but it's everybody trying to deliver on the ground that tell us whether that's absolutely a bonkers idea or not. And so that is what we kind of try to draw from our members and from networks like this to reflect back to government. So it's great to be involved in it, real privilege. And I'm hoping you'll get a lot from it, because, you know, it's everybody's network rather than a CIH one. As Matt and Eden have said, we're really keen that it supports a real good flow of connection and information and support for one another in delivering in what's a pretty difficult sector, really, you know, with some challenging things going on. So Matt, I don't know with that if you wanted me to pause or to just carry on.
No, I think that'd be lovely. I think if you, yeah, as I said, I see a couple of people introducing themselves in the chat, which is wonderful. So please feel free to. We'd love to know kind of where people are from and what you'd like to see from the group this year. And I'll pass over to you to look at that, the regulatory changes and kind of what's going on from the policy side, I guess, in this sector. And there's in a sector, I think those who work in it understand it better than the government, but that's just maybe my own point of view. I'll pass over to you.
Okay, no, I'd probably echo that in terms of some of the discussions. It's really hard with civil servants often parachuted in to get to know what is a pretty specialist area and you know, a really skilled and challenging area as well. But I will now try and share. I'm just going to give a bit of an overview of where we're at in our regulatory framework, hoping that I can get this to work a bit more successfully than... How's that?
Wonderful.
Brilliant. So I'm just going to spend a few minutes looking at the new regulatory framework. And as I say, I'm coming from the perspective of the regulated sector, registered providers. And I know that Eden's going to bring the perspective in from the sector that's not registered providers, charities and CICs, so that hopefully we get a rounded view of what some of the policy framework is for us and how that impacts on practical delivery. So obviously the key piece of it of legislation for the social housing sector, probably the most important piece of legislation for years has been the Social Housing Regulation Act, and it's brought in a whole raft of changes for the sector, most notably reasserting a proactive consumer regulatory aspect. Previously, it had kind of like shrunk back to being focused more on governance and economic viability. And the consumer element was there, but it was like a very high bar for the regulator to be involved. But now we have a proactive consumer regulatory framework again. And the impact, the voice of our tenants and residents will become a key thing that our regulator is taking notice of in a positive way, not just in terms of major problems, but in terms of how we're delivering our services, what our accommodation is, how we're interacting. No, so obviously repairs is always a big one on that, but complaints. And so there's been a whole kind of like follow through after the act has been set up in terms of consultations. It's felt like a bit like consultation dominoes. One's gone past and then the next one has come along, you know, since the act has been in force. And So we have a new set of consumer standards that have just been confirmed that will start to be applied from April. We've had a consultation on tenants' rights and complaints. So exactly the information you should be giving your tenants about their home, about the services in their home, about their tenancies, as specific as that. If they have different tenancies, they need to know what it means for them with their tenancy and how to complain. Obviously, we've had the Housing Ombudsman refresh its complaints handling code because it now has a statutory basis and a statutory duty to make sure that if you're one of its members, you are complying with its complaints handling code. And it puts out a lot of spotlights if people have ever come across those really useful reports with the learning it's had from as it's looked at complaints that have been brought to it. And I think there's going to be a greater expectation that landlords will be thinking about how that, you know, they might take on board some of that learning. We've had a consultation around the regulator's use of its powers. It's got more extensive powers now about following financial issues and being able to get information from third parties around finances, around the penalties it can put in place, the requirements for you to, if you're found wanting in an area or non-compliant, to have a performance improvement. So a very proactive, how are you going to resolve the issues that might come up? I'm going to touch a bit on AWAB's law later, because although it applies to the regulated sector, again, I think some of the issues about knowing your homes and knowing your tenants applies across the board. And as we look at that, what will come for the supported housing sector, you know, I think that might be it might be worth knowing what else is going on in terms of the requirements of other providers. We have a competency and conduct standard consultation out around professionalism, and I'm really keen to hear from you on that. Again, it's for the regulated sector, but I think that, you know, it's interesting to get a perspective of what that impact will be if you are a registered provider, particularly if you're small and a specialist. But also, what might it mean for if you're not in that sector, but you can see what expectations are being required. We're still waiting for a consultation on the access to information, which will require housing associations to, it's like a freedom of information for housing associations, basically. So I just want to pause a bit on the competence and conduct standard. We know where the Social Housing Regulation Act came from. Obviously, it came from the tragedy of Grenfell and a lot of reports about how tenants didn't feel listened to. They'd raised issues that they felt if they'd been listened to, they may not have experienced some of that because they raised issues around safety, etc. And that whole kind of listening to and responding to tenants appropriately raised issues around what the standards were for people working in the sector, and a big commitment in the Act that professionalism of the sector was a huge way forward and a way to resolve some of the issues that cropped up. So a lot of the focus around the competence and conduct standard has come down to the qualification element and the mandatory level. But I think what we forget is that this is set within a bigger standard that requires providers to have a clear way of training and developing their staff and monitoring performance. So that competence and conduct of all housing staff is the underpinning standard. And then on top of that, there's a mandatory qualification which is applied to directors and senior managers. And they've left it at that level, I think, because they see those as kind of the people setting the culture within the organisation. And they're also trying to limit the impact of potentially, if they made it a requirement across all staff, they might have toppled over into the housing associations, might become public bodies and all the debt, etc., that we had a few years ago. So they've kept it structured around those senior staff. But the idea is obviously setting a culture that is about listening to and responding to tenants and managing all of the housing management elements competently. And the staff involved in that obviously is not just housing management, but repairs and assets as well, given where obviously this came from in terms of it raising issues around being listened to around some of the safety and maintenance areas. There is also a provision that if you outsource some of your housing management, there's an expectation around your service providers that they also meet this standard as well. And I think that largely was to capture Elmos, but obviously it does mean if you outsource, or if you are perhaps someone who provides those services for a larger housing association, that this obviously will touch on you too. Now, obviously, the key one for everyone around the table here today is the Supported Housing Regulatory Oversight Act, which came into force which was passed in June and was brought into force. It was expected to be in force 2 months later. And I mention that specifically because there are a couple of things within that where we should see action by August, because there was a requirement in the Act for action within a year of commencement. So obviously this was trying to tackle some of the issues that were reported around poor quality housing or support or both within the exempt accommodation sector. And it's about trying to strengthen the regulation of both the standards of that accommodation and support, and the proliferation in some areas of this kind of accommodation, and the management, the ability of local housing authorities to work to manage in terms of the wider community. So it's trying to close gaps in regulation that were exploited by some bad faith providers, whilst not stifling good quality provision, because we need more of that in a lot of places. Now, there have been working groups going on after this. So it had the 7 clauses you'll be aware of. So the first clause was that there's going to be established a supported housing advisory board to give advice to the department, to give advice to local housing authorities and social services authorities. That's one of the things that needs to be set up within a year of commencement of the Act. So technically by August, we should see work on that to set up that advisory board. The second clause was to expect local housing authorities in partnership with social services authorities to establish, to develop local supported housing strategies every 5 years. We're expecting the development of national supporting housing standards for England, which will cover both the quality of accommodation and the quality of support services. And then several clauses were around enabling local housing authorities to set up a licensing scheme to manage this sector in their locality, and the purpose of it has to be to ensure that those standards are met and to manage that positively within a local community. We need a statutory instrument with regulations laid before Parliament for that. And there have been, I'm aware there were working groups going on all of these areas, because my colleague was involved in a lot of them, but we're still yet to see what's coming from that. And we haven't heard anything more recently. It also has provision if within 3 years the Act hasn't had the necessary impact on raising standards or managing the issues around exempt accommodation, that they could introduce planning regulations so that local authorities can more control where these things are in their locality. And a few other things, such as making sure that if people did move from inadequate supported housing because of the accommodation or support, they wouldn't be intentionally homeless. So those are some of the big provisions of this Act, which will, as we see more come out of it, and we should expect them soon, will have an impact overall and not just on sort of the regulated sector. I wanted to flag AWAB's law because it's an important one around quality of homes. Now, again, AWAB's laws come out of the Social Housing Regulation Act, so it only applies to registered providers. But I do think that if national accommodation and support standards are set, they may very well look at what else is around them, what the other expectations are. So AWAB's law, decent homes, etc., to set a bit of a standard there. And so AWAB's law sets out what hazards, it's not just damp and mold, which I think has surprised the sector a bit. It's gone and looked at all hazards that are significant for health impacts. It sets timescales around when investigations have to happen, and it's very clear around making sure that tenants are aware of what action is taking place. There has to be a written summary of what the landlord's going to do. So it's really significant in terms of setting timescales, and I think also making sure that landlords are going to have to be very careful about keeping records and being able to respond appropriately and quickly to tenants, and having a clear communication ongoing with tenants around repairs. So interesting to reflect on what that might mean for any services that are delivered in this sector. That also, it was calendar rather than working days, which was an interesting has interesting implications for the sector. And I won't look on that, but just to flag up that for CIH, we're aware that this is a really squeezed sector. So one of our issues in our 10-point plan and our kind of strategy for housing is that we need further investment in supported housing, but we also need further investment in revenue support to make schemes viable. So just to say that that's on the radar of the value of this sector for people that require that support, and recognizing the squeeze on it. But we're always open for more from you about what we should say and the evidence we can give around trying to support this sector. So that's a bit of a framework of from the regulated side, but I'm over to Matt and Eden for their reflections on the broader sector, which would be really useful to know. Thanks. Thank you.
No, thank you, Sarah. Eden, I'll quite happily bring you in, because evidently I know this has been something you've been heavily involved in recently.
Yeah, it's quite interesting. So I'm very keen to hear from other people here that's not a registered provider of social housing currently, because like I said before, I'm currently working for HRD called HFT, so we're not a registered RP at the moment. But majority of this new regulatory framework obviously will have that cascade effect to us that's not a registered RP, or those that's just a registered charity, or might be CIC and things like that. So one of the things that Sarah's mentioned around proactive consumer regulation. So obviously don't be deceived by the word consumer regulation. So it's basically making sure, you know, that our tenants or people we support, their voices are heard. I mean, that is just basic, I think, standard within our service, especially for those learning disability charity, mental health and things like that, to make sure that we're listening, I think, to our customers, we're listening to what is important for them, that we're listening to about how we could improve our service moving forward. So, I mean, within HFT or within my organization, it's something that we are very keen to adopt, even though we're not registered RP. So we started to make sure that we got a really good consultation process. We get the feedback from customers. For example, if they don't have a capacity, if they're learning disability, you know, if there's any appointee, they got advocates and things like that, but they still need to be included in a way, and we still need to get their views and feedback on how we could make their life better, really. So that's very important for us around the voice of tenants and residents. So obviously, I'm quite keen to hear from other registered charities here on how in your own organization are able to capture it, or is this something that your organization currently working towards around, you know, hearing voices of customers and making sure those feedback are implemented. So let us know. Feel free to raise your hands if you got anything there. Another thing is around complaints. So that's a biggie, big. So obviously with registered provider of social housing, they have recourse to the housing ombudsman. It's very specific, the stages of complaints. You know, you get your stage 1, stage 2 complaint, and they have the recourse to the housing ombudsman. And obviously your policies and procedures are very robust in terms of what can be classed as complaints. So on the other end of spectrum, for those that are not registered provider of social housing, how does your complaint system looks like? How can your tenants, especially if tenants have learning disabilities, they don't have capacities, or they're very limited on their understanding, how can they make a complaint if they're not happy with their service? What what measures you got in place for that within your organization. And obviously within our supported housing networking group, this is the time to share best practice on what we can do to make it easier. So for example, within our organization, learning disability, obviously we try to adapt as much as possible the proper complaints procedure. What is a complaint? How can people raise a complaint? Make sure it's heavily publicized on our website, and it gets allocated to an investigating officer. And obviously you get your set time scales and things like that. And obviously people are not happy with your response. How can they escalate it and what recourse they could have? Some organization, CQC, for example, most of us will be registered with CQC, so obviously we'll probably adapt certain things through that way. But I think it's very, very important that that robust complaint procedure and that recourse of tenants to again hear the side of the story if something's not working quite right. So again, I'm quite keen to hear from other agencies here how your complaint system are looking like. I'm going to touch quickly about the AWOP's law. Obviously, it is on Sarah's PowerPoint there. Obviously, it's registered provider of social housing. But I did say, it is a bit of a common sense, really, because you're talking about health and safety of your properties and the condition. And I think for supported housing like us, most of our tenants or people with support are vulnerable. And I think it is just right that the properties we're offering is of really good standards. And again, for other organizations, how are we going to be affected by this? Would we need to have a robust sort of inspection system on our properties? How well do we know our properties? Do we have a system in place to record conditions of our properties and the surveys in place? So that would be our housing management system is quite important. So again, we need to think about implications of AWOP's law moving forward, especially some of us, our organization is not as big and a lot smaller. So it's something to think about moving forward on the impact of that. I'll come back to you, Richard. You get your hands up. I'll come back to you in a little while. I just want to touch up quite quickly around the competence and conduct on professionalism. As most people have known me, obviously I'm heavily involved with the CIH and I'm quite big around professionalism and qualification and things like that. So I do understand. So within my organization, HFT, we have actually started to adopt this qualification element because we pay towards the apprenticeship levy anyway. So as part of I completely understand that, learning and development and training budgets is not the best currently within some of the organizations, but we tend to use a lot of the apprenticeship levy. So most of my housing officers are going through level 2 property and management apprenticeship, level 2 and level 3s. And also some of the senior housing managers are going through some of the qualifications as well. So we try to invest heavily on developing staff and developing managers to make sure they get all the right tools to enable them to do the housing job itself. Because I could imagine most people within our sector might not have the housing itself background, maybe the care and support background, but not necessarily the housing background. So which is something that, we're really focused heavily on that. And Richard, you still got your question?
Yeah, do please come in.
Yeah, thanks, Eden. It wasn't really a question, it was just a response to some of the issues you raised around complaints, first of all. So I work for an organisation called the Extra Care Charitable Trust. We are a registered provider, albeit a small provider. We've got about 4,000 properties, but only about 800 of those are social rent. The rest are effectively private leasehold. So we do subscribe to the Housing Ombudsman, but we also in effect apply the Housing Ombudsman code to our leaseholders as well as our social renters. So that was just sort of observation number one. We also provide care, so domiciliary care basically within our retirement villages. And it was just sort of picking up on your comment, Eden, around kind of access to, complaints for people that, may not have capacity or, may not have recourse to the Housing Ombudsman Service. We changed our complaints policy recently to make sure that all of our residents that are making complaints about our care service automatically get categorised as a formal stage 1 complaint and are advised of their rights to escalate to the local government and social care ombudsman. And I think the local government and social care ombudsman and the housing ombudsman have spent quite a bit of time in the background kind of aligning their complaint codes because they were quite different. I mean, back along the local government and social care ombudsman, I don't think actually had very specific timescales for resolving. It just kind of said reasonable. So for your client group, learning this, if they are receiving care, then potentially they will have that route to the local government and social care ombudsman. The other thing I just wanted to pick up, what you said, Eden, was just around what I see as another challenge for small providers, and that is around AWAB's law. So like I say, we are a small provider, although we've got 4,000 properties, but we don't have a housing management system. We've got lots of Excel spreadsheets. If you want to see an Excel spreadsheet, I can show you lots of those. But I think that's going to be a challenge for small providers. How to robustly collate and record evidence on a robust system. Because investment in a housing management system is substantial, really. I mean, I know you can get them off the shelf, but there's still a lot of money and they require a lot of investment in terms of resources and implementation and data cleansing and all of that kind of stuff. So I think that's a challenge for small providers. So I'd be interested to find out how people are navigating that, really. So those are my kind of two observations for what they're worth.
Thank you, Richard, and really, really appreciate it. I know from, like I said, I'm on the board for Spring. We're having exactly the same issues. I think anything to do with engagement is going to be absolutely key. And certainly what's interesting, so I mentioned I work in recruitment. I've actually found over the last 2-3 months, for the first time, a new vacancy coming out, which people are calling like a TSM officer or an engagement officer that isn't your traditional engagement officer, but their role is almost to work as a housing officer, but their sole role is to build relationships. They don't have a patch as such, because they're not looking after income, they're not looking after anything like that gets reported back, but it's about that collaboration piece. And you can see in the chat there that Sarah's mentioned that they see that our third-party managing agents and support providers as their customer voice as well. So last year used a consultant to get feedback about how well they're doing as a landlord. I would really recommend it, but I've noticed that there's a lot of work to do. So they've altered the processes so that our third-party support providers and agents can access the complaints process more easily and voice complaints on behalf of residents, which is a really interesting piece to look at. So thank you for sharing, Sarah. Wayne, I'm going to bring you in.
Hi, cheers, Matt. Just to introduce ourselves. So Richard, my journey in supported housing has been around for about 9 years now. Started off as a supported housing provider ourselves. When we look at the issues in supported housing, we always talk about the tenant's journey, tenants' complaints. One of the things that we found is that tenants don't really get a choice when they come into supported housing, so they're generally told obviously where to go and live. So we developed obviously roommatch.co.uk. We're now trading all over the country, working with various RPs, housing associations, CICs and exempt providers. One of the biggest things that we found was obviously the tech side. So we've been launched now just over 12 months. We've got another organisation now called RM Solutions, which is a full intensive housing management system. It does all your tenant support. It actually tells you when tenants are not being supported. It's got a full intensive housing management, so it does all your maintenance, your deadlines on maintenance, does all your financing, service charge recording, certification, compliance. If anyone's interested in having further conversations around that, obviously I'm more than happy to have talks. I say we want to try and get obviously heavily involved in supported housing to ultimately drive this sector forward. It's been held back over the last few years, and we always talk about a poor provider. So obviously we want to concentrate on obviously the positives now moving forward. And I say we're in talks with multiple local authorities, housing associations, CICs, and exempt providers. So someone with the smallest voice can have the biggest impact. So literally we want to hear from literally everyone within the sector.
Thank you, Wayne. So I know when Richard was bringing some of the points you were talking about, I saw you nodding along from the CIH perspective. Was there anything there that was going to really tick in boxes for you, or flashing light bulbs, as it were?
Yeah, no, I think it is. It's really interesting and very good to point out that actually, yes, the Housing Ombudsman and the local government and social care ombudsman have agreed on this code, so the same complaints handling code will apply, and it is really important that people in different tenures actually are enabled to understand their rights as well. So I think that's really positive. But I think a critical thing is going to be that issue around how you run your data systems, because increasingly not just for kind of repairs or AWAB's law, but overall, I think the sector has been kind of like with the spotlight on knowledge and data that the Housing Ombudsman brought up, it is a real challenge for the sector, and it is a huge challenge for small providers. And I think it's a question of how what's going to be really important, and this is big providers as well, how you use all of your systems, because so many have like different Excel sheets, or you have different systems running different bits of your business. And what's really going to be critical is how you actually pull that intelligence together. And I think that's what the Ombudsman and the regulators probably going to be looking at, because from the perspective of the consumer standards, what the regulator's been saying is know your homes and know who's behind your front door. And I don't think kind of the usual approach around just sample surveys, etc., is going to be adequate response in terms of knowing your homes. And I think also it is going to be about trying to make sure that those you don't usually hear from, you connect with and you hear from in some ways. So I do think that's going to be a huge challenge. And it's in terms of resources, it might be fall particularly for small ones, but I think for large ones, it's going to be the multiple systems and how you connect them. And I think it's a real challenge.
Couldn't agree more. I was going to just say, on that, when I sat down with the regulator, the Ombudsman last September at CIH Southwest Conference, one of the things they said is, if all we can do is show a mirror, and if we can find the golden thread, you should be able to. And when you come to data, that's exactly it. If we can find the problems A to Z and see where it's missed, then you need to be able to. If you can't, then it's a different conversation. But that was 100% the conversation coming out. So great to have you with us. Do please come in.
Thank you. I just thought I'd pick up on a couple of points, particularly just what you said, Sarah, around the multiple systems and the way that people record information. So I work for a registered provider. I'm the management agent on their behalf for their supported housing stock. And what we've actually identified is that because the group has gone through several different mergers, we've got several different platforms that we're working on. So I do appreciate when you've got a small provider that actually I know how costly it has been for us over the last 2 years moving to get to one system, and it is eye-watering figures. So from an RP that's quite small, that's going to be really difficult for you to be able to bring that information together. I do get what you say though, so if the Housing Ombudsman can actually see that link, then we also should be able to see it. But like most in the sector, there's lots of people using spreadsheets, and they're not fail-safe, are they? And you have a system outage and you've lost all of that data. So it is really like key that people consider how they're going to do that, and perhaps where Room Match came in and identified that could be a solution. That might be something that smaller providers might want to look at, because if it has got that IHM system. So I'm not a salesperson on behalf of that speaker, but there were a couple of other things that I felt that were quite important. So for me, one of the biggest issues I see is that the exempt accommodation is being eradicated insofar as when benefit claims are being put through, and needing to have that intensive housing management support. We've been challenged several times now by 2 local authorities around, actually, we don't class that we're classing that as personal support. They won't state and accept that actually to support somebody to sustain a tenancy is actually managed support that is not personal, because there are so many elements of what an individual might need. So we're finding that particularly with housing benefit now being pushed for people to go onto universal credit, it means there's a 2-pronged approach. So you have to sort of go through the UC channel to put your benefit claim in for the intensive housing management side of it, and for the other element you go to the local authority, and the local authority have been squeezed by the DWP to make sure that actually they're not paying for stuff that should be being paid through from UC, but UC then don't approve it. So you're in this really bad situation. And I think if you add on to that the fact that they're actually going to be wanting local authorities to introduce licenses, then it will be really useful to understand what that really looks like. So we had the Levelling Up Communities. I went to a meeting in January, somebody that we invited in as part of a partnership group that I work with, to get an understanding of where they were going with the licensing and what the Supported Housing Regulatory Act was going to have an impact on our services. And suffice to say, we were assured that there would be a consultation starting on the 12th of February. I think I must have missed it because, you know, I have so many emails. Perhaps it's just not arrived in my inbox. Being a little bit facetious there, but nonetheless, we know that there's an act that's coming in. I think the other thing that I wanted to just talk about is actually, yes, I do work for quite a large organisation. We've got like 18,000 properties, so it's a significant size. What we've done around our complaints side is actually we're restructuring our service so that we don't have several people acting and issuing and dealing with one complaint. So we're going to have like an advocacy service, so that actually you put in the customer at the forefront of everything, and when that complaint comes in, it will go to an advocacy team, and actually it will be that person that will then go and collate all of the information from the different parts of the organisation to get a really consistent resolution for those customers. And the final thing just wanted to touch on is that we've actually got a customer partnership panel. So anytime that we have any policies that are going to be reviewed or introducing new ones, we go to our customer partnership panel, and whoever it is that's writing that policy will present that to them and ask for their feedback. And that is not just a tick box exercise. We will make changes based on feedback if it is appropriate to do so, and we will then we'll go back to them and do a you said, we did, so they can clearly see what impact they've had, because I think that's really important, that our customers do have a voice and can see that it makes a difference. And then the other thing I think I was going to talk about was just how we've also made it that our customer partnership panel become part of our boards. So we have 3 different boards and they will have a voice on our boards as well. A lot of information there. I don't know if that
really useful and really interesting, and certainly it's good to see what, you know, the different avenues you're trying to do to get on top of it. But I think it also highlights the challenge, the fact that even the larger providers going, we're having to do all of this and we're still kind of chasing a bit. And I say, I mean, Spring, we're a much smaller provider. The issues you highlighted with you know, universal credit and benefits, you know, the amount of time it's taking us to get money at the moment from Birmingham City Council is really concerning, and we're okay, but I'm hearing about problems right across the country, but certainly in and around Birmingham, of providers going, if this carries on, we're going to collapse, not because of we can't afford to run, but because we're not getting the money through. So really glad you highlighted it, Sue. Thank you. Richard, I'm going to bring you back in.
Yeah, thanks, Matt. Yeah, it's just sort of pick up on some of the things that Sue has said. I mean, I think essentially the issue for small providers is capacity. I mean, there's a whole lot of regulation being chucked at small providers through the the Regulatory Oversight Act and the whole kind of licensing stuff that we've got to get our heads around, and also the compliance with the consumer standards. And my question really, or my query was, I just wonder how the regulator is going to regulate compliance on the consumer standards for small providers. What they've said publicly is, the standards are the standards. You comply or you don't comply, essentially. But I wonder in practice what kind of approach they are going to take with small providers. I'm aware that the NHF are about to launch a toolkit, I understand, a small providers compliance toolkit. I don't think it's out yet, but I think it's fairly imminent. So it'll be interesting to see that when it arrives. But I just wondered really what other small providers think about the kind of the regulatory kind of inspection regime. I mean, I don't even know when the regulator's thinking of inspecting small providers. They've said publicly that they've got a 4-year program for large providers, so they're going to take 4 years to get round basically all the large providers. So, but they've not actually publicly said, well, are they going to be doing small providers as well as part of that, or are they going to leave small providers until a later date, or are they just going to deal with small providers if they get issues raised to them? I don't know. So I'd be interested if anybody knows the answer to that question, really.
This is something actually that came up. I was at the NatFed Finance Conference last week. I was speaking on one of the panels there, and one of the seminars I joined was for small providers. And what they found, actually, and a lot of people were saying there, was you have obviously your NatFed conference group or your whatever groups you have, but your small providers group is just one group which covers absolutely everything. There isn't like a small providers finance, a small providers support, or whatever it will be. So really glad you highlighted it, because we were exactly the same, and it was something that was being called out for, saying just because we're small doesn't mean we don't have the same issues, but we just have them at different levels of concentration depending on what we're doing. Matt, I know you've been waiting a while, so Matt Dudley, do please come in, and then we'll come back to some of the points raised by Richard and everybody else. So thank you.
Good morning, everybody. Just a couple of things, really, just off the back of what Wayne was talking about with RMS. I feel like I'm advocating for him without any financial reward, but we already use RMS here at Also Housing. And we're a fairly moderately sized organisation, but we work off the back of a registered provider who do all the hard graft with the regulator, so we don't have to. But it does mean that we can concentrate on what we need to do, and that's housing management and support. And RMS allows us to do that in a way that we've probably not experienced before. And I heard Richard talking about the multitude of Excel spreadsheets that you use. It has took the pressure off using multiple spreadsheets. It hasn't eliminated it, so we still need them, but it has meant that all of our information is in one place, and support workers and housing officers on the ground are able to access this information in real time, and we can report back to the auditors when they come out and talk to us about how good our support is. We can show them how good our support is. We can run off reports. We internally can see how our support workers are getting on with the work that they've been tasked to do. But more than anything else, the support workers with the residents are able to have a much more organic and fluid process with how the support is managed and what they can see as well. And they can see a progress, they can see that there's outcomes, and they are very visual. Everything can be signed electronically. I mean, it's a fantastic system. And I mean, Wayne seems to pop up every time I do anything to do with supported housing. There's Wayne selling his wares. And I will say it's a fantastic service. So it's well worth looking into. And, Sue talking about cost, and for smaller organisations, actually, in the grand scheme of things, it isn't as expensive as you might think. And for us anyway, it's been value for money. And I know you can spend lots of money on these services. We use it twice, actually. We've got our own contract with RMS for what we do internally, because we've got services that aren't part of the housing benefit network on the exempt system, and that don't involve a registered provider, because they're Ofsted regulated services. And then we also have we piggyback off the registered providers contract with RMS to do with our exempt accommodation, so we use it twice. They pick up the tab on that one. So that's the first thing. Just to say, it's a really good system, well worth looking at if anyone's interested. And yes, cost is an element of that, but I think you could probably argue the cost and the benefit will have on your organisation. And just going back to Sarah, what you were talking about earlier about the changes and the proposed changes for supported housing moving forward. I'm not sure if you're aware, but do you know how? I mean, you talked about local authorities licensing people like ourselves, etc. What's the thought process with? And I'm hearing loads of rumours whether or not they're going to move a lot of the responsibility for exempt accommodation to local authorities in terms of the funding element. There's almost a conversation somewhere about moving to a supporting people model type thing again. Is that something you're aware of? And how do you see the funding of supported housing moving forward? Is that something that's likely to change significantly? And is money going to be squeezed if it's ring fenced with local authorities?
Right. So we haven't heard, well, periodically things crop up, don't they, to suggest that maybe a support element should go to local authorities, because we had that way back in 2011. We had that proposal that they'd introduce the LHA rate and anything above will go to local authorities, and the sector generally pushed back on that. And that's kind of what led to some of the loopholes in exempt that in the HB that's led to some of the issues cropping up around less than satisfactory exempt accommodation. I haven't heard that I haven't heard recently, but I'll put feelers out. I haven't heard recently that there's a plan to move it to a support element within local authorities. From CIH's perspective, we recognise that a lot of schemes are really stretched in terms of viability, and we need that kind of revenue support element back, which we are asking for, and for it to be ring fenced. I think if it goes into local authorities non-ring fence, there's a real problem, because we know that local authorities are super stretched. They have statutory duties if they're unitary that are their care. And often, well, the support used to go straight to the upper tier anyway, didn't it? And there was always the issue about if it's a 2-tier, how that's managed. So we would have real reservations if any funding pot, whether held nationally or locally, wasn't ring fenced, because local authorities are under such a stretch. But we haven't heard that is being proposed, although it's come up in the past. And obviously it was, you could argue, very successful when it was supporting people, and the problems didn't come until it was non-ring fenced. Let's face it, it was squeezed from the beginning because it was higher than everybody expected it to be, and then when it was removed the ring fence, it was obviously a time when local authorities budgets were being squeezed, and that's what you saw. And when you think about how local authorities budgets are at the moment, hugely squeezed. If it's a local housing authority, really pressured by the temporary accommodation element. If it's social services, it's really the spend so much on adult social care and children's services. So yeah, if it's not ring fenced, I think there would be concerns about that.
I mean, we sell it to local authorities if we're trying to get into a new local authority, that actually we're a good idea, because we save them money ultimately. Because if they utilise us, they don't have to use their own HB benefit, HB pot, and all the rest of it. But some local authorities don't understand that, and I would have grave concerns about them managing this, because they just don't understand it. I mean, the regulator for social housing doesn't understand exempt accommodation. The councils, in most parts, don't understand. We're the only ones that understand it. So to try and explain it to them is very difficult. And I worry about the future because of the way it's been so badly managed in, say, Birmingham, where that has highlighted the issues. My concern is moving forward, if the local authorities get their hand on any aspect of this, they're going to pick it apart, because they're going to see this as part of their statutory organisation. They're going to see it as a part of their day-to-day responsibilities, and they're going to pick it apart. So it's interesting. I'll be interested to see how things move forward with this.
Yeah.
As I suppose everybody else will. Thank you, Sarah.
Absolutely.
I think it goes back a little bit as well to that point Richard made earlier, which is, we've got a 4-year cycle for the large providers. When are they going to get to the small ones? I can't imagine that in 4 years, whoever was first in that 4-year cycle is going to suddenly not need to be re-looked at. So it's going to be a real challenge. I think we've got, a lot to come up over the next year, and where we've only got kind of a couple of minutes left. So I've just put in the chat there that if anybody would like to just talk, mention any topics they'd like to see come up through this group over the course of the next 12 months, please say. The idea behind this group, as I say, is that it's ours. It isn't affiliated to myself or Eden or Sarah or the CIH or anyone in particular. It is a collaborative group for change. I agree with Matt completely that Wayne is at every single event ever running talking about Rematch, but it's it's one of those. Fair play to the guy for getting around and selling the services. But
I do try my
I know.
best.
Well, this is it. But I mean, we've got the recording all set up, so we'll get that shared. If anyone would like to get a hold of either Eden or myself to join the WhatsApp group, please do. I'm probably easier to get hold of on LinkedIn. Eden's probably the same, so do reach out. But Sarah, thank you so much for bringing such insight today from the regulatory side. I think it was really interesting to get a feel for what's going on, when that's going to reach some of the small providers. I think it's going to be an ongoing debate we're not going to know about until much later. Eden, thank you for your insight into what's going on the charities, the CICs, and that non-regulatory side, because sometimes that voice can be forgotten about. And as I mentioned at the beginning, I think it's one of those areas that probably gets left behind most quietly in the group. And actually, I can see that somebody had mentioned in the group there that would be a great topic to talk about, which is how we as a landlord are able to more get involved in procurement and other areas. So we'll be in touch. We'll get dates out for the next event. It will be on this link again. So we'll keep this as the group. So if you do have ideas later, just put them in this group on Teams and we'll collaborate and we'll think. But for now, to everyone who could join us, to everyone who had insight today, thank you so much. It's been a great first session. Welcome back. And we'll get the date for the next event out soon. But Sarah, Eden, especially, thank you so much for today.